Hello everybody, Tom Fiala, board certified plastic surgeon from Orlando, Florida here. Today's reader question is, Dr. Fiala, how do you recommend choosing the size for breast implants? Well, that's a great question. It's probably the most frequently asked question on places like realself.com if you look at the breast augmentation questions. So here's what we do. So number one, we start with a good discussion with the patient. I really want to understand what they have in mind, what they would like, what they want to avoid, and the amount of fullness that they are hoping for, and that sort of thing. And so that gives me an approximate idea of where to start. The second thing I recommend that our patients do is they bring in a selection of photos of implant results that they like, and also implant results that they don't like. And that way we can talk about them and try to analyze the features that appeal to them and make sure that we avoid the things they don't like. Next, we do a series of measurements of the person's breast and chest, and so that we can find something that really fits proportionally to their frame. And that really is a key part. And we want to have the implant width in particular to be matching the width of the person, so that it's wide enough this way that the cleavage looks good and not a big wide gap, wide enough this way that it fills up the breast, but not so wide that it sticks out of the side, making the person look fat or bulky. Because most ladies do not want to have a whole lot of side fullness. They'd rather be slim and trim at the side here. So measurements are very, very important. Lastly, we do try-ons, where you try on the implant in a sports bra and a t-shirt, and we also use a series of shaped inserts known as the Mentor volume sizing system to really predict what the shape and size of the breast is going to look like after surgery. We have used computer imaging in the past, but honestly I have found that the software is really not quite where it needs to be quite yet, and I think that the try-ons really give people a better idea of how things are going. So that may change in the future as the technology improves. So that's what we do to choose the implant size, and with this approach and some care and thoughtfulness and good discussions, it usually works out very well. Thank you very much.